Hello everybody. Today I'm gonna talk about the brachial plexus. So brachial plexus, it's a network of nerves coming off from the cervical spinal cord, and then they join together, make a plexus. Brachial means arm, so it goes down to the upper limb and it supplies the muscles of the upper limb, and it also provides the sensory innervation for the skin on the upper limb. Today I'm going to use the whiteboard to draw the brachial plexus for you, because it's, as its name suggests, it's a plexus. It's a complex plexus, one of the complex plexi in our body. So I'm going to draw it for you, try to simplify for you, and I'm going to use some beautiful models to show you the branches. So brachial plexus, as I mentioned earlier, it's coming off from the spinal cord. So imagine that this is your spinal cord. So spinal cord has different segments. We have cervical segment, thoracic, lumbar, sacral, and coccyx. So cervical segment made up of the 8 segments. They are numbered with C1 to C8, and thoracic, they are numbered with T1 to T12 segments, and then we have lumbar segments L1 to L5, sacral S1 to S5, and finally coccyx is a single segment. So we have 31 segments. So this is the spinal cord with 31 segments. Imagine that here we have the X-shaped gray matter. If you take a cross section through the spinal cord, we have X-shaped gray matter. It is comprised of 2 ventral or anterior horns and 2 dorsal or posterior horns, and it is surrounded by this white matter. So the anterior horn or ventral horn contains the cell body of the motor neuron and the axons of the cell body of motor neuron coming out of the spinal cord, and it passes through the ventral root. So ventral root contains the motor nerves, and then we have dorsal root, which is passing through the dorsal nerve, which is passing through the dorsal root. So imagine that here we have dorsal root, root. So it contains this sensory neuron. Where is the cell body of the sensory neuron? So the cell body of the sensory neuron is outside the spinal cord. It's here, which is known as the dorsal root ganglion. So on the way of the dorsal root, we have dorsal root ganglion. Then dorsal root and ventral root, they join together, make spinal nerve. So a spinal nerve is a mixture of the motor neuron and sensory neuron, and then it splits into ventral ramus and dorsal ramus. So the ramus means branch, so spinal nerve branching into dorsal ramus and ventral ramus. Dorsal ramus goes back and supplies the skin and the muscles of the back. Ventral ramus is important. So the ventral rami, they join together, make a plexus. So we have plexus, brachial plexus here, brachial plexus. So today I'm going to talk about the brachial plexus. So the ventral rami of the spinal nerve C5, C6, C7, C8, and T1, they join together, make brachial plexus. So here we have the roots. We have the roots for the brachial plexus. The ventral rami of the C5 to T1, they make the roots of the brachial plexus. Then roots come together, make the trunk. So C5 and C6, they join together, make the superior trunk. C7 continues by itself to make the middle trunk. C8 and T1, they join together, make the inferior trunk. So we have three trunks. I'm going to show you the roots and the trunks and the spinal cord on the models. So if you look at here, this beautiful model shows the different parts of the spinal cord. If you take a cross section through the spinal cord, at the center we have this X-shaped or H-shaped gray matter, which is comprised of the dorsal horn and ventral horn. And you can see dorsal horn gives off some axons of the motor neurons. It's a dorsal the dorsal horn is here. This is the ventral horn. So ventral horn gives off the axons of the ventral root, which is the axons of the motor neurons. So they pass through the motor neurons passing through the ventral root. And dorsal horn, you can see dorsal root. Within the dorsal root, we have the sensor neurons. This bump is called the dorsal root ganglion, which contains the cell body of the sensor neurons. So ventral root and dorsal root, they mix together and make the spinal nerve. So spinal nerve coming out of the vertebral canal, and immediately it splits into large ventral ramus and a small, which you can see here for this segment, small dorsal ramus, large ventral ramus. So ventral rami, they join together and make the brachial plexus, for example. Here I showed you. And I'm going to show you another model. So if you look at here, on this model, you can see here is the spinal cord. Spinal cord at the neck, we have the C5, C6, they join together, make the superior trunk. C7 continues by itself, make the middle trunk. C8 and T1, they join together, make the inferior trunk. So we have three trunks, superior, middle, inferior trunks. So as you see here, the roots on the right side, you can see the roots are covered by these muscles at the neck. They're called the anterior scalene and middle scalene. Then trunk, superior, middle, inferior trunk, popping out between these two muscles, anterior scalene, middle scalene, and then they divide into some divisions I'll explain to you. So I showed you the roots of the brachial plexus and then the trunks. So each and every trunk gives up some divisions, anterior and posterior divisions. So for example, here you can see the anterior division of the superior trunk, and this one would be the posterior division. I'm going to use the green one. This is the posterior division of the superior trunk, and then we have the posterior division of the middle trunk, and also the anterior division of the middle trunk, and also we have the posterior division of the inferior trunk, and finally anterior division of the inferior trunk. So if you look at here, we have three trunks, so we have three anterior divisions and three posterior divisions. So here is the divisions, and this part is known as the trunk, and this part is known as the roots. So if you look at here, three posterior divisions, they come together, make posterior cord. So here we have the posterior cord. And anterior division of the superior trunk and anterior division of the middle trunk, they come together, make the lateral cord. And finally, anterior division of the inferior trunk. It continues by itself and make the medial cord. So cords are named according to their relationship with the axillary artery. So imagine that here we have an artery, it's called axillary artery. So lateral cord is lateral to the artery, medial cord is medial to the artery. At the back we have the posterior cord. So axillary artery is in the armpit, in the axilla. So all these divisions are formed behind the clavicle, and then cords go down and they form at the axilla, around the axillary artery. So I can show you here on this beautiful model the cord. So you can see here is the axilla. You can see this is the arm. At the top we have a scapula which is covered by the muscles, and this is the clavicle. So if you look at here from the front, so brachial plexus coming from the C5 to T1 spinal nerves, and then they give off some trunks and then divisions. So divisions are just behind the clavicle, are formed behind the clavicle, and the cords are in the axilla. Here is the axilla, armpit. And you can see the axillary artery. Lateral to the artery we have lateral cord, medial to the artery you can see the medial cord, and at the back you can see the posterior cord. So then each and every cord gives off their main branches. So we have here some branches. So posterior cord gives off two main branches. One of them is known as the axillary nerve. The other one is radial nerve. Lateral cord gives off a branch. It's called musculocutaneous nerve. And all medial cord gives off a main branch. It is known as the ulnar nerve. Between the musculocutaneous and ulnar nerve, in the middle we have another nerve which is formed by the lateral cord and medial cord both. It's called median nerve. So laterally we have musculocutaneous, medially ulnar nerve, in the middle you can find the median nerve. If you look at carefully here, you can see that we have a Mackey's sign here. I've provided a video for you about the Mackey's sign in the armpits. So McDonald's shape, it's the M-shaped nerve here, is formed by the musculocutaneous, median, and ulnar nerve. So we have 1, 2, 3, 4, 5 branches. 3 of them coming from the anterior divisions, lateral cord, medial cord. 2 of them coming from the posterior divisions, posterior cord. So axillary nerve, radial nerve, they're coming from the posterior cord. So axillary nerve only, it's really short, it supplies only this muscle, deltoid and teres minor. Whereas the radial nerve, as it's coming from the posterior cord, it's trying to go to the back of the posterior arm and supplies the posterior arm muscles, and goes down and supplies posterior forearm muscles. Whereas the musculocutaneous and ulnar nerve, they're coming from the anterior division. They supply the anterior arm, anterior forearm, and hand muscles. So there are some mnemonics that help you memorize the main branches. So we have 4 main branches. The mnemonic is MARMO. M stands for musculoskeletal, A axillary, R is radial, M median, and U stands for ulnar nerve, MARMO. 5 main branches. The other mnemonic is this: remember, to, drink, cold, beer. So remember to drink cold beer. Remember it stands for the letter R, root as well. 2, trunk, drink, divisions, cold, cord, beer, branches. Remember to drink cold beer. It's a mnemonic that helps you to memorize the order of the structures that are making or forming this brachial plexus. Now I can show you the main branches on this beautiful model. So again, here is the axilla or the armpit. You can see the clavicle. Posteriorly we have the scapula covered with the muscles, and here is the arm muscles. Here is the axillary artery. As I showed you, laterally we have the lateral cord, and sorry, this is the lateral side, so this is the anterior. So this is the laterally we have lateral cord. Medially you can see the medial cord. Posteriorly here we have the posterior cord. So lateral cord and medial cord, they come together, make the median nerve, which is traveling alongside the brachial artery. This is the median nerve. And then this medial to the median nerve, from medial cord we have another nerve. It's known as the ulnar nerve, going to the back of the funny bone, medial epicondyle. And finally here you can see another nerve here, which is coming from the lateral cord and piercing this muscle, coracobrachialis. It's known as the musculocutaneous. So musculocutaneous from lateral cord, ulnar nerve from medial cord, and median nerve from both, they make the Meckel's sign or M-shaped nerve here. And then you can see here the posterior cord gives of this branch. It's called the axillary nerve, which passes or exiting the axilla through this quadrangular space to get into the deltoid muscle. So deltoid muscle would be this one. So it covers here. So axillary nerve supplying the deltoid muscle. It also supplies this muscle, as you see here, it's the teres minor. And you can also see the other branch coming off from the radial nerve. So you can see here, it's the radial nerve coming from the posterior cord, going back and supplying the posterior arm muscle. You see this is the radial nerve.